Okay, so now we've started the head, we came down, right, and now we're going to come to the pelvic region, another major, right. So for proper lymphatic drainage to come down, because we came down here. The best thing is to come down from the sides. You take, again, 4 fingers, and again, for your own side, if you were doing it yourself, you're kind of coming down, with your 4 fingers and coming down the side body and coming to your belly button. It's almost like you're coming around, coming down to your belly button. And you're going to do that 6 to 10 times. Again, we're sharing the load since I'm doing this and she's doing it herself. And fighting that fluid, and fighting the inflammation that's in your body. 2 more times, 9 and 10. Good job. And then we want to make sure that we're also not missing, because all these organs, everything in your body, right? You're protected by all this fluid, right? That's inside. Everything that's holding your body in place is actually surrounded by fluid. Your heart, your lungs, your liver, your pancreas, your kidneys, your ovaries, your stomach. Everything is in fluid, right? Which means there's fluid in everything that's that it's contained in as well as around. So we want to make sure that fluid is free. So even coming through your torso, you're going to start like the middle of your chest and you're coming down. What's amazing is her stomach on cue. There is many times that as soon as you do this, your stomach is going to gurgle because it's like, whoa, you're sending me fluid and I'm not eating. I need to process. Your stomach acids want to process the fluid that's coming down. That's good. Some people feel it as soon as you come down your ears and down and swallow, immediately going down your throat. That is good. The more your stomach is processing, your stomach acids knows what to do with that fluid to get it where it needs to go.
And there's so many overlaps for this with our types of concerns. Gastroparesis, those electrical signals through fluid in making the upper intestines work and process functionally. This can help with that. Some of you guys who know my story, I've had the median arcuate ligament release, and this is going right along the line of scarring, which is almost a year old, so it's safe. But you do want to be very communicative with your practitioner, because this can also generate an increase in blood flow. And if there is compression on that artery, it can have a painful after effect. So if you don't know if you have MALS or if it's irritating you, if you're not sure, and you have some lymph work in this area, and then you feel maybe additional postprandial pain after eating, if you feel any echoes or even sharp and severe after this work, that could be what's going on. Not that the practitioner did something bad or wrong, but that there's issues with possible vascular compression, and that can occur up around the stomach and also around the kidneys. So listen to your body. It talks to us a lot. And don't give up on your lymph work just because something flared.
It was very important. So there's a lot of times one of the major issues that people have. So if you take a line and you from your belly button and you go out to the right side, kind of from things right here, it's called an IC valve. And it's below the pancreas and the liver, and it tends to be where toxins sit. It's also where a lot of people have a lot of issues digestively speaking. So from a lymphatic perspective, we always like to make sure, as we said, we brought down from the torso, we came around the sides. So again, if you take your finger to the belly button and you cross over, I'll make a little line, about 2 inches, and you just do small little circles. That little valve is what traps poisons and fluids. And you'll know because you'll feel kind of a popping.
I felt the popping and a little gurgling in there.
And that is the releasing of the toxins. So your believe it or not, people think their appendix not always does work if you have one of those still. But this is one of the things the appendix does, is help to gurgulate that toxins from your liver and your pancreas. And so by doing this motion with lymphatic and little circles in that, like I'm not trying to apply too much pressure, but I just wanted to feel it down there, will actually relieve that toxin. And then I move it. We move it to the pelvic area, again, to get rid of any toxins. I would not be surprised when you're done with a lymphatic, even on yourself, even self-lymphatic, that you should have to go to the bathroom afterwards. In fact, I would expect it.
And we're going to talk more about water later in the videos that continue, so.
Yeah.
It
is important, very important to hydrate when you're doing this. We've been kind of doing it in between the segments for her, and that's okay. If you need to hydrate in between, the only way to survive is hydrate to be great. I promise that. Okay, we're going to move down the body, okay, and we're going to come down because this was the major lymph node, was our pelvic, right? But now we have a long way to go. We have again, if you think about it, here's our pelvic area, and where we need to go is all the way behind the knee. If you think about it, that's a lot of area coverage. How do you best drain? So that's what our next segment is going to be.